Good morning, good afternoon, good evening to everyone joining us. Thanks for joining us today. We will be starting shortly. Let's just give others a few more minutes to join in. Thanks, everyone. We will be starting shortly. A few more people coming in. Let's just wait a few more minutes. We will be starting shortly. For those already on the call, could I ask that you take the time to introduce yourself in the chat? Tell us where you're joining us from, what work you do. That would be great as we wait for others to join. Morning, Sarah. Thanks for joining. For our Spanish speakers, this session is being translated as well. So if you need to, please select the Spanish interpretation if you need it. Hi, Jane. Thanks for joining. Hi, Sema. All the way from India. Welcome. Thanks for joining, John. Okay, I think we are at 5 minutes past and we can start. Once again, a very good morning and a good afternoon and a good evening to everyone joining us from wherever you're joining us. We're very, very happy you could take the time to join us today. This is our third webinar on the Spotlight series on foster care practice, focusing on safety and protection in foster care. Again, a reminder that this webinar is being conducted in English with simultaneous interpretation in Spanish. If you'd like to access the Spanish interpretation, please follow the instructions that will appear on your screen. Today's webinar is also being hosted by the Transforming Children's Care Global Collaborative Platform. This platform is a community of actors and organizations that are engaged in child protection and care reform. The overall vision of the platform is to establish more strategic sector-wide collaboration from the global to the local level by coming together to build on one another's work in order to secure a greater and more sustainable impact, as well as taking joint advocacy. This platform is open to everyone. There's more information in the chat. We will put more information in the chat if you need it, as well as how to join if you've not already. As a member, there's a lot that you get involved in, as well as receiving updates. So we do encourage you to attend and join the collaborative platform. There's lots to learn and discuss with others. Once again, my name is Barbara Abe. I am the Regional Family Care Advisor for Catholic Relief Services, co-chairing the foster care task force and working group with Louise Cox, who you will be hearing from shortly. Today's webinar, as I said, is being recorded and will be available in Spanish and English. The slides will also be available. For those of you that are just joining us, it would also be great if you could put your names in the chat, organization you work for, the work you're doing, which country you're joining us from. We also want these webinars to be engaging. So, we have a chat function, we have a Q&A section. If you select the panelists and attendees option to chat with everyone, we want to hear from you. We want to hear what you think of some of the conversations we're going to have. Ask questions, please do ask questions using the Q&A functions, and to upvote for other participants' questions, as well as leave for us comments so we can make sure that the areas that you're most interested in are discussed and are responded to. The last two webinars, we weren't able to get to all the questions, but we're really going to try this time around to answer as many of your questions as possible. So please do feel free to ask us questions as and when they come in. For this particular webinar, this is the third of 5 webinars about different aspects of foster care practice that will be taking place once a month until August. The last 2 dates should be on your slide. Throughout, we've been hearing and we'll continue to hear from people from many different contexts to talk to us about their learnings and practice, as well as hearing from people with lived experience. One of the purposes of this webinar is to really capture this learning and experiences to inform a thematic brief paper specifically on foster care. After each webinar, we will be convening a task force group to further unpack some of these key aspects of foster care and have more detailed conversations that will ultimately support the development of the brief. If there are questions that we do not get to through the Q&A session, please don't think we won't get to them, but we encourage you to join the task force, because if questions are not responded to here, we will bring them to the task force meeting where we will try and address them there for further unpacking. But we will also like to encourage you to join the task force group through the Global Collaborative Platform. There you can access some of the responses to the questions that we might not be able to get to. So it's really, really important that you join that if, for example, you feel that we haven't fully answered the questions or may not have gotten to the question that you've asked. So there'll be information shared in the chat and later in the webinar about how to join that as well. In terms of our agenda today, we will be hearing from 3 presenters who will take us through different aspects covering our key topic today. And then we will try and make sure we get to a section where we can specifically ask these 3 presenters some of the questions that you will be asking us, and also ask them to dig deeper into some of the things that you will have indicated that you'd like to know a bit more information on. And then we will close with some updates in terms of upcoming activities and some of the things that we think it would be important for you to know. Our first presenter today is Louise Cox, who I think we all know by now. But Louise has over 20 years of experience supporting children and young people in a variety of settings. She has worked as a social worker and manager within fostering services in the UK, for Child's Eye Foundation in Uganda, and now for the Martin James Foundation. Her current role involves working alongside partner organizations in the development of family strengthening services and alternative family-based care. Thank you so much, Louise, for agreeing to share with us some of your vast experience. Over to you.
Thank you, Barbara. Hello, everybody. Nice to see lots of people on the webinar today. So I was going to give a bit of an introduction to today's webinar, and I was thinking about the key subject that we have about safety in foster care, and it seems really appropriate to say something about assessment at this point. And I know it's not called assessment everywhere, not everywhere will have a formal assessment, and it often depends on the legislation or the statutory policies, as well as policies and processes at a service level within individual organisations as to what happens before children move in with foster carers. But I was going to talk to you today a little bit about my own experience as a practitioner from that perspective, and my learning and the learning I've done from talking to many foster carers over the years that I've been doing fostering assessments. So just to start briefly with looking at some of the key elements from what an assessment looks like in the UK, specifically in England. There's quite a long assessment process in England that people go through. It can take up to about 6 months to complete. The social worker visits and spends time with the family and will write a report, and they will make a recommendation as to whether this is a family that will become approved as a fostering family. The recommendation goes to a panel, a fostering panel, who also make a recommendation after hearing from the social worker, from the prospective carers, and reading the report. They make a recommendation back to the service, who then makes a decision as to whether the foster carers become approved as foster carers. So it's not only been myself making the recommendation, but also the recommendation of the panel, which does add another level of safeguarding to that process. So the assessment itself covers various aspects of people's lives, and in the visits we do to people's homes, these are some of the conversations that we'd be having about what their motivation to foster is. A big part of the assessment is the background and the experiences of the carer. Also the views of the carer, and in particular relating to how they raise children, or have raised children, their views on that, and about their views on discipline, for example. The home environment, so what space is available? Is the home clean and free from hazards? Who lives in the household? So anyone who lives in the household becomes part of the fostering assessment, and this includes the children and the adults in the home. And the support network of the carer, who will be able to offer these carers support, both practical support and emotional support, if they were to become foster carers. these are just some of the areas that the assessment focuses on. But overall, the assessment process is about ensuring, I think, as much as possible, the physical and emotional safety and well-being of the children that will be cared for in that family. So I found really that it's been important to help people understand that process, because they're coming into a long and quite challenging process sometimes. I try and explain that to them right from the beginning, so they know what to expect and they could understand why we're taking this process and the steps we're taking to try and ensure the safety of children. I also try to explain to people, and actually that sometimes it can be good that the assessment takes a few months to undertake, because the process also helps with the preparation for those foster carers. So it's really been about sharing information with them, as well as me getting information and finding things out from them. But it definitely can be a daunting process for prospective carers, as well as, in honesty, a daunting process for the worker, I think, sometimes, to undertake such an assessment. I've certainly felt it myself, that it's a big responsibility. I felt that to make a recommendation about the future safety of children feels really big. It's been really helpful for me to have reflection time with colleagues, with people around me, with my manager, to be able to talk through the assessments that I'm undertaking and share concerns and any challenges with other people. Could I have the next slide, please? Thank you. So over the years, I feel like I've learned something each assessment I've undertaken, and I'm trying to take on board some of that learning each time to make the next assessment a better experience for the prospective carers, as well as trying to think of things to help myself as a practitioner. So I've come up with a checklist that I use for myself to prompt some thought processes as I'm doing this. And I go back to my own checklist quite a lot to have a look at that and remind myself of some of the key things that I've learned. So I'm going to share some of those with you today. And these are some of them. So the first ones are about children and their perspective. So I try and think, when I'm out visiting families or writing my assessment, how will a child feel living here? And how would I feel if it was a child that I cared about living here? And so try and think about it from their perspective. How will a child experience this family? Asking a question, even if it's difficult, which is something that I've progressed in, I think, during my time doing this, but it's not always the easiest thing, because I think sometimes there's difficult questions to be asked and it's not always easy to do. So I prompt myself that even if it's difficult, ask the question, because we're thinking about the safety of children and we're thinking about the preparation of those foster carers. And sometimes they would want to have those conversations and have those questions asked. I think there's lots of reasons why it's sometimes difficult to ask certain questions. Culturally, it can be difficult to ask particular questions. Here, for me, when I first started, I was often, pretty much always, younger than the people that I was assessing, and I found that very difficult, especially when there was personal questions and talking about perhaps a couple's relationship. That felt very difficult. Financial issues can also be sensitive here, and I guess it depends on the context you're from, of what conversations are more challenging than others. But I would prompt myself that to ask the question if I felt it was necessary. And included in that, if I went away from a visit with something that felt uncomfortable, knowing that I needed to go back and revisit that and have an open conversation so that I could feel confident in my recommendation. So moving on to think the unthinkable. And I think this is a difficult one. Again, it's a phrase that's used in the UK quite a lot in terms of safeguarding, because we don't like to think about children being harmed in foster care. And equally, we don't want to feel suspicious of everybody either. So there's a balance somewhere. But what I was aware of doing the assessments was that children have been harmed in foster care. So it's good to have that awareness while doing the assessment. I always wanted to challenge myself to make sure that I was being fair and objective. Wanted to make sure that I wasn't being judgmental in my assessment in any way. And I think for me, it was important to have an awareness of who I am and my own experiences, my own childhood and upbringing, because that really impacts on where I start from and my views of things. So I just wanted to have that awareness while I was undertaking the assessment. Correlating the information was also important for me. So I would take up different checks and references. So that might be to verify some of the information. A lot of the information here that form the assessment is self-reported. So I wanted to be able to verify that. So that might be speaking to friends or family or neighbors. If their children were at school, then I'd have a conversation with the school. The children of the carers were really important to talk to. And of course, if they were in the home, in part of the household, then they would be part of that process anyway. And I always really enjoyed this part of it because you could be really creative and play games and do fun things with the children to help me connect with them, but understand them, understand what it was like to live in that home. And also, how did they feel about another child coming to live with them? Also, if the carers had children that didn't live with them, I would try and meet with them. And if they had adult children who were living independently, would always meet with them. But it was great if they had been brought up by those carers, it would give you a real insight into what that could be like. Equally, if they hadn't grown up with them, wanted to just explore that a little bit with them and what that had been like. And then evidence the statements that I was making. So this I found quite an important part of the assessment process. So I wasn't just making a statement saying, because I liked this family, that this family will be brilliant foster carers. I needed to be able to say why why I had formed that opinion and my recommendation. So maybe that was because that I'd spoken to someone, I was aware that these people had already looked after other children in the community. Maybe that was based on my observations of them with their children. Maybe a neighbor had told me that they were always very welcoming to them and their children. So I would be trying to base my statements on evidence that I had gathered throughout the assessment process. And this formed part of the analysis of the assessment. So I wasn't just telling a story about family, but considering how those people's experiences impacted on them and provided them with the strengths and the skills and knowledge to be great foster carers, and also what were potentially their vulnerabilities as foster carers. So the assessment would help me to identify those and think about the sort of support that they might require. Definitely the way I've approached assessment has changed over the years I've been doing it. And I now very much see a key part of my role would be to support carers through that process, but also not just to get them through the process. I could easily write a report that got carers through the panel and created many foster carers, but actually to carefully consider and help this family prepare them for being carers, and to really consider the suitability of this environment and the safety for a child that would be living with them. So I've tried to be transparent and open with the carers to build some trust with them so they could talk to me and they could feel that they could have those conversations that were sometimes really quite personal conversations, that they could be honest with me, and they could feel safe and understand the process. So they were just a few of the things that I've learned from doing the assessments myself, and things that I would keep in mind when undertaking that process. Can I have the next slide, please? So what I was thinking about is that there's all the checks and all the assessments that we're doing, but also whether or not a child feels safe there is different again. So I pose this question here as to what makes us feel safe. And I think there could be lots of reasons for feeling of safety, and whether that's the environment that you're in, or the people around you that are familiar, or the routines and traditions of your family, and all these things that are familiar to you. But as we know, when a child moves into foster care or some sort of care, everything can change. So the people around them and the environment and their routines all change at once. So nothing is familiar to them. And I think that's something that certainly I, as an adult, would find very challenging. And especially for a child who may have experienced traumatic events in their past, may not have been able to rely on adults previously. So I was thinking about how the assessment can support that. And I think it brings us back to discussions with the prospective carers about understanding children and the things that they may have experienced. And like I say, those conversations have really helped me to think about the sort of support the foster carers might need and might be helpful for them. And in particular to that individual family, it might be very different from one family to another, the sort of support that might be helpful. But I think also that has helped, having those conversations help prepare the carers and support them to think about how they're going to build a relationship with a child. How are they going to show affection to a child, and how will they connect with them and support their sense of safety and belonging, even if this is just for a short time. Anyway, well, thank you for spending time and listening to me. But that's just some reflections I have as a practitioner undertaking foster care assessments. But with these thoughts in mind, I'm going to hand you over now to our next speaker, who is Andy Breslin. Andy is a teacher at a university in the UK. He has lived experience of foster care and is an author. He's travelled through childhood trauma and the care experience, addiction and incarceration, and now teaches at MSc level to prison officer graduates on the Unlocked Graduate Scheme. So my pleasure to hand you over to Andy. Thanks, Andy.
Thank you very much, Louise. I'm just hoping that everybody can hear me, because I had a slight issue with the microphone when we first logged on before everybody joined. As Louise said, I am currently, and when I go on to explain my background, is probably in an interesting position at the moment, because I work for Leeds Trinity University, and I teach prison officers on a master's degree, which is the level 7 course in higher education, and the criteria for them to come on my course is that they will serve 2 years as serving prison officers, and they will complete the academic side, which I teach on, and then after that the potential for them to go on and be criminal justice leaders is there for them. But this job only started in September. The reason why I'm here talking to you a little bit like Louise about my reflections is because prior to September, I was a child looked after specialist in the youth justice system here in Leeds. And the one thing to point out before I go on and explain some of the statistics and my job role is that most children that come into the youth justice system do not come into contact with the criminal justice system. So most children, that come into the care system do not come into contact with the criminal justice system. A recent report actually highlighted it was about 94%. So most children do not. Having said that, what we found in recent independent reports here in the UK is that at all levels of the criminal justice system, so arrest, in the youth justice system, in the community sentences, and particular the prison system, there is a significant disproportionate number of children, of adults that have experienced care and care leavers under the legal definition, which I won't go into in too much detail. And I have a background, as Louise said. I was in care for around 2.5 years when I was a child, and that was a result of lots of childhood adversity, abuse and neglect, and my mum not being able to meet mine and my siblings' needs as children. Ironically, my mum was in care and fell pregnant with me whilst she was still in care, so she was 16 years old, which, as I'm sure most of you will understand, meant that there was lots of challenges for my mum to be able to meet my needs. And then by the time she was 24, she had a 5th child on the way. So very, very difficult circumstances. Unfortunately, by the time I was 15, I was addicted to heroin and excluded from school. These weren't issues that were necessarily connected to my childhood experiences of care. They were more connected, which I'll go on to explain with other children, to the reasons I entered the care system and the challenges that I faced on an interpersonal level within the family environment. And so could we go on to the next slide, please, if that's okay? And we could probably pop on to the next one again, please. So I, as Louise says, I've authored 2 books. My first one was about my own experiences of coming through care and criminal justice, and my second was about how I used those lived experiences of navigating the care and criminal justice sector to build connections, as Louise was talking about, and develop an understanding with the children that had rebelled against the care system and ended up coming into the youth justice system. Now, in 2016, there was a report done by Lord Laming here in the UK, and that was done in partnership with the Prison Reform Trust. So they wanted to look at this disproportionate number of children that come through the care system that then end up being in the criminal justice system, and explore how we could do more to prevent that number, or those vulnerable children experiencing things that means that they end up in our criminal justice system, which is a very expensive system to run here in the UK. So as a result of that report, I was already a qualified youth justice officer working in Leeds Youth Justice Service. But up to then, as Louise was talking about assessment, in the Youth Justice Service, just like in the social care service, we assess the child's risk of reoffending, and we assess the child's risk of serious harm to other people, and then vulnerability. So they're the 3 criteria of assessment. Now, if a child was in care prior to 2016, it would, of course, come under the assessment principle of being vulnerable. But there was no real tailored intervention from a youth justice perspective for those particular children coming into the system. So they were identified as vulnerable because they may be in the care system and not responding well to it, potentially running away, or in residential care, which is often an institutional care service that many children struggle with for a whole host of different reasons. But in 2016, as a response to what they found in Lord Laming's review, I was appointed as the first in the country, actually, child looked after specialist. So my role was to prioritise the needs of looked after children in the care system that were coming into the youth justice system. And part of the job description was quite varied, actually. So I did a lot of face-to-face work with looked after children that came into the system, which I'll talk about in a bit. I had a strategic role working with social care and our partners to try and intervene early to get the services that were required around the foster carer or the residential homes where the children were coming from, to try and prevent them coming through to the youth justice system. But most importantly, the one bit that I felt it's important for me to share with you guys today was I wanted to profile what did we know about the looked after children that were coming into the youth justice system, which interested me. Because if we're saying that only 6% of the children in care come through to the youth justice system, what I wanted to know as a specialist prioritising their needs was, what do we know that's slightly different about that particular cohort? Now, I've been working in youth justice since about 2007, so I knew pretty much all the children that had been incarcerated that we were working with, that were looked after. So I wasn't surprised when I went to the police and the data that they gave to me, because what I asked the police to do is tell me of all the list of children that were incarcerated between 2014 and 2019, when they came into care. Well, I got that from social care. What I got from the police was there criminality in the family prior to them coming into care, and did they have contact with that family whilst they were in the care system? And then again, I looked at the type of placements that those children were in. And the data that they came back with, I think, was quite profound, and it's going to be interesting, as I appreciate that you guys are obviously working in a completely different social context, but nevertheless, to prevent children coming into the criminal justice system that have had a care experience, this data is quite important to know. So what we found was that 93% of those children, so only one of those children that we profiled, came into the care system after 8. Now, on a personal level, why that felt interesting to me is because, as Louise said, I was incarcerated by the time I was 17 and addicted to heroin. Now, what we were doing, I think, in the UK was creating a causation where actually there was a correlation. So the number of looked after children that end up in the prison system seem to be those children that come into the care system late. So when we're looking at the care system being the causation, actually what we're finding is that it's the factors that lead children to come into care in the first place, for many of those children, are the same factors that lead them to being involved in criminality. Because if a child is in the care in the family placement for 8 years, for many of them it was in adolescence when they were coming into the care system, it's really important to think about what that slide on the screen shows. So I'll run through that now. If you can see on the side, this is Bruce Perry is a specialist in childhood trauma, and he's American, and in a lot of his work he talks about relational poverty, because we know a lot more about economic poverty, i.e. wherever the social system that you're working in is, you will have a marginalized group of people that don't have access to resources. And that I'm guessing that won't matter whether you're in Africa, in the UK, or in the USA. And that's fairly well understood. What's less understood, according to Dr. Bruce Perry, is that we have a spectrum of relational wealth, i.e. having adults that can meet your needs, that are attuned to your needs, that are consistent, that are caring, that are nurturing, that are protective. Now, what I found from my experience of working in the youth justice system is that if you have, obviously, a family that has financial stability and they have relational wealth, so that child's needs are met, they are far less likely to experience significant trauma or adverse childhood experiences. Simultaneously, you could have a child growing up in economic poverty, so they're growing up in areas here in the UK where it's where there are lots of challenges and there are lots of violence, community violence, etc. But if their parents are supported within that environment, that child's needs can still be met, and although they're experiencing community harms, their relational needs being met buffers those experiences. However, for the many children that I've worked with in the youth justice system that have been in care or not, what we found with those children is they've simultaneously experienced both. Now, many of those children, the 93% of children that came into the care system late and then entered the youth justice system, if they've spent 8 years in an environment which they have in relational poverty, in economic poverty, but simultaneously, the relationships that they've had around them have been pro-criminal and have been unable to meet their needs and have been, in many cases, the root causes of the harm, that's when you find those children actually find the entry into the care system quite difficult. And I found what Louise was saying quite interesting, because she was talking about safety and belonging. Now, when I was a child, by the time I was excluded from school, adults persuaded me to sell heroin for them, and that's how I became addicted to heroin. But when I reflect back on my childhood experiences, I'd experienced so much violence and I'd experienced so much criminality in my family that actually those groomers, perpetrators, the adults in my life, although they presented significant harm to me, they were actually my safety and they were my belonging. And I think when we're talking about this particular group of children that come into the care system, and I'll go into explain in a minute, what we need to do is make sure that foster carers, even though they've been assessed, as Louise pointed out, we need to find a mechanism that ensures that they are getting continuous professional development, because in my experience, when this particular group of children enter the care system and either go into the foster care system or into residential care, sometimes many of the staff or the foster carers, they don't fully understand. They know that the children have been harmed, but they don't have the kind of training or the expertise to be able to manage those behaviours. And I'll explain that a little bit more now. So if we can flop onto the next slide, please. The other two statistics, what I wanted to share when I got the multi-agency set up to profile the children that came into our youth justice service, was that, so as I said, 93% came into care post 8. 93%, so almost all, had criminality in the family. You see, that's not always the case for children that come into care. Sometimes children's needs aren't met, but it doesn't necessarily mean that there's criminality in the family. And then 82%, again, almost all of those children had been in residential care. So what that enabled us to do as a youth justice system is think about the type of children we were working with and their profiles, which meant that we could respond appropriately to their specific needs. Now, what you can see here on the slide is the work of Jack Shonkoff from the Centre on the Developing Child in Harvard University. And I think that many staff that I've worked with sometimes don't understand how dysregulated a child can become when they don't feel safe or when they don't feel accepted and they've experienced significant trauma or violence, as I did as a child. And what that can do is that when you don't feel safe, you become dysregulated, angry, frustrated. And I think I really like this slide because Jack Shonkoff and the Harvard University, what they did is they highlighted that stress is the root cause of much of dysregulation in children. And actually what we have is that we have positive stress. So we can have, if you're going to get a job interview, I'm sure, or before I speak today, because public speaking is quite challenging, I can have a brief increase in heart rate and mild elevation of hormone levels. But it's not bad for us, it's good, and it builds development. Now, going back to my slide previously, we can have tolerable levels of stress. So those children that are growing up here in the UK in economic poverty, i.e. they've got less resources and they're living in areas of high crime and deprivation, they can still experience significant harm in the community. But if they're going home and either mum or dad or mum and dad are still nurturing, caring parents, what happens is they buffer the experience, the dysregulation, the stress response system. Again, going back to my previous slide, when it becomes toxic is for those children that have been in sustained stressful situations. And just like myself, because my mum couldn't meet my needs and I've never met my dad, even though I was experiencing community violence, criminality at a very early age, drug addiction in my house from the adults, etc. That stress became toxic for me and I couldn't manage school and I found myself getting marginalised from all these different pro-social experiences that would have helped me mitigate the harm that I'd experienced. And this is when substance misuse comes in, because actually what cannabis and heroin can do for a child that doesn't understand that they're experiencing these toxic experiences is they can help the child regulate their stress response system. So although my drug addiction was a problem, it was a reaching out for a solution. Can we go to the next slide, please? So for some of you guys that are developing your care systems in your own country and looking at what that looks like, it's absolutely vital that you look at policy and legislation and assessment processes like Louise was talking about, and standards. Absolutely vital. But when we're talking about children that have experienced attachment issues and toxic stress and trauma, we must never forget that the core of the improvement of outcomes for those children is always going to be about relationships, because the root cause for most children that experience harm is interpersonal harm. So therefore the solution, my view, is that it lies in connections and relationships. And so what I came up with in my second book was a model around how to build and navigate relationships with children that have experienced the same experiences that I did as a child, and how I've used those experiences myself at practice level to use those experiences to help me build authentic connections with children. Because for children like myself, that we cannot assume that that is easy to do. That is very difficult to do, because we, again, going back to myself, we don't automatically feel a sense of belonging because a house is stable or because a house is welcoming. Those families need to understand that for children like me, they're going to have to do some almost attunement, some adjustment, and ensure that the child feels that you understand their skills, their background, and their experiences. And that is not an easy thing to do as a foster carer when you've got safeguarding responsibilities and you're trying to reduce risk factors and stuff. So in essence, my this model is not originally mine. It comes from someone called Dr. Dan Siegel, who is an expert in interpersonal neurobiology. And he talks about, particularly when it comes to parenting, being present. So being able to get a gestalt of information when you're working with somebody, whether that's a child or whether that's an adolescent, to be able to reflect on yourself and how you're responding to that individual. And because that's really, really important. The attunement bit is then how you fine tune yourself to be able to respond to the child's needs, relational needs. And that might not always be the kind of typical response that you might give to a child. It might be that actually you need to reach into where they're at to be able to get them to get to where you want them to be. And that's not, again, not an easy thing to do. And I go into more detail on that in my book. And then connection. This was more really about working in youth justice, because in youth justice, when I first started, we used to use the word engagement. But there's a power differentiation when we use the word engagement, and traumatized children sometimes don't legitimize authority. So just saying the child is not engaging, I don't think was enough. So my recommendation to the youth justice system is if we switch the word engagement to connecting, it puts just as much responsibility on us as professionals and adults to ask ourselves, are we connecting to that child as much as we're expecting that child to connect with us? So a slight switch from child's not engaging to are we connecting puts a little bit more responsibility on the professionals. And if we follow these steps, we're more likely to get trust from children that have experienced social harm, that have, like me, I was taught not to trust social care. I was taught to not trust the police because if they came into our lives, they would take me away. So inevitably, when they took me away, I thought my mum was telling me the truth and that the social workers were actually a harmful entity. So and I'm not saying that this is a model that necessarily you would have to lay out for your own context. But what I do think, in my experience, and I'll leave you with this, is that in my experience, this particular group of children, when they feel like control is being taken away from them, they become triggered. So what all my work since being in my role has been is empowering children to tell us what it is that they need. Now, that might seem a bit strange because you're dealing with children, but actually, they've had the power taken away from them pretty much their entire lives. So if you empower them in whichever way you can to make sure that you acknowledge their skills that they've had to navigate the spaces that they've been in, and acknowledge the background that they've come from and how difficult they're finding it just being in your home, even though that might be difficult for you to understand, I think that is the best way to work with this particular group of people. And actually what we do is we speed up the maturation process and prevent them getting further involved in the criminal justice system. So that's my reflections. I will leave you with that, and I really, really appreciate you listening to me, and hopefully my stress levels will come down now I've finished. Thank you very much.
Thank you so much, Andy and Louise. Very powerful practice and lived experience insights. We do have one more presenter, Anderson Silvasegaram. I hope I pronounced that right. If I didn't, I'm so sorry, Anderson. Anderson is a founder and executive director of Soka Society, which is focused on some key areas of work, such as creating access to education for Indigenous children, restoring victims of human trafficking, and protecting unaccompanied and separated minors through community placements and case management. Anderson is currently working with the government to implement the alternative to detention pilot project for unaccompanied and separated minors. In 2015, Soka Society won the prestigious UN Malaysia Award in conjunction with the United Nations 70th anniversary. So we're really, really happy to have him here. He holds a Bachelor of Science degree from the University Putra, Malaysia. He's also an alumni of the International Visitor Leadership Program run by the US Department of State. In 2016, he was appointed as the International Detention Coalition Regional Advisor for Southeast Asia. He's also a steering committee member of the End Child in Detention Network Malaysia, and serves as a member of the National Project Advisory Committee. So we are so happy that Anderson could take the time to join us in this webinar. Thank you so much, Anderson, and over to you.
Thank you very much for the introduction. It's an honor to be on this platform to share in terms of how we look at community placement and case management, which definitely intersects with foster care as well. Maybe we can just start with a little video. I mean, the video maybe helps us at least understand the context, the type of population we work with, and gives a very quick overview of the type of work we do, particularly related to the community placement and case management program. So maybe if I just ask for the video to be played first.
Ahmad is 14 years old and all alone in a strange place. This country is not his home, and his parents are not here. He doesn't speak the language. He has no proper documents. The police could arrest him and put him in immigration detention. He has no food, no money, no one to look out for him. How did Ahmad get here? Ahmad is what we call an unaccompanied or separated child. These children are below the age of 18, not in their home country, and are without a parent or caregiver. Ahmad's family was escaping the war. Somehow along the way, they were separated. Other children like Ahmad are running from religious or ethnic persecution and had to leave their families behind. Others were simply abandoned. Who will look out for these children? Organizations like Soka Society help such children find care and protection. When a child is referred to a case management program, they are assigned a case manager who will journey with them. The case manager builds rapport and trust with the child, assesses their needs and risks, and develops a plan with the child to navigate their life and achieve their goals. The case manager also works with foster parents and service providers to implement these goals. The case manager visits the child regularly and journeys with them until they can safely return home or find a new country to live in or turn 18 and are able to live independently. The goals of case management are safety, stability and permanency, and well-being. Along the way, we can help children develop resilience and strategies to cope with their challenges.
Thank you. Next slide, please. Just a little bit on the organization, Sukha Society. We are a nationally registered society. We're a charity, and therefore we. Next slide, please. And therefore we work specifically on children-related issues, and we focus a lot on the best interest of a child. The next slide. Now, maybe here, maybe we want to share in terms of how we go about running our program. Just want to say that, of course, there are many ways to run a program like this. We've looked through in terms of how we would like to do this. And when we started this program, probably about 7 years ago, we were looking at maybe two approaches. The first maybe just looking at community placement being the primary approach. The second, looking at case management. But we felt that as a civil society run organized civil society, and then therefore the program is a civil society run program, working with population of unaccompanied and separated minors who do not have access to state managed services. We felt that there were two approaches we can look at when it comes to designing a program. The first is looking at alternate care needs as of the unaccompanied child. And here our program calls it a community placement as the main focus, and use case management as a tool for child protection. The second approach we were looking at maybe is to look at case management as the main structure of the program. And within that structure, we have community placement as a subset to address alternate care needs. In actual practice, to the unaccompanied child, in terms of service provision, there is no real significant difference in either approach. But the first approach places the weight of responsibility to the foster parents, while the second approach places the weight of responsibility on the case manager. Our program, CPCM, adopts the second approach. And maybe I'll share a little bit in terms of why we've taken the second approach. This is because the foster parent population we work with here in Malaysia are from the similar background as the unaccompanied minors in our program. In our program, we receive a lot of referrals from vulnerable refugee and asylum-seeking unaccompanied children from ethnic groups such as Afghan, Somalian, Rohingya, Kachin, Lisu, and so on, to ensure that the unaccompanied minors are placed in communities where there are no barriers, such as language, religious practice, customs, and traditions. We find foster parents who are also Afghans, Somalians, Rohingyas, Kachin, and so on to be placed in. And because Malaysia do not have citizens from such backgrounds, naturally, most of our foster parents are also refugee families residing in Malaysia. Therefore, we felt that it is unrealistic and, in a sense, unfair to place the burden of responsibility to fully support the unaccompanied child to an already marginalized group of persons. Next slide. The starting point for our case management process when an unaccompanied minor comes into our attention is where they are referred to by agencies or just maybe a community leader, a school teacher, the minor's family member, an extended family member, the minor themselves, other organizations, United Nations, hospitals, or maybe sometimes even government agencies. As for the community placement process, the potential foster parents that are identified through our network with communities of similar background or as the minor. Next slide. And therefore, being from similar background, it means that our foster families, as mentioned, are mainly refugees and refugee and asylum-seeking families. Therefore, the work we do with them would require a lot more effort in supporting these families, because most of these families are from the lower income bracket. Many are good families, but certainly not able to financially take on the responsibility of providing care for another child. As such, in our program, we incentivize foster parents by providing rent for the room to be occupied by the minor, food for the minor, fees, if there is, or when it comes to education, developmental needs, medical, counseling, and any other incidentals, extracurricular activities. This is to ensure that foster parents are not required to use their own financial resources in supporting the minor. They just need to focus on providing care, protection, and support for the child. Next slide. If you maybe look at our flow chart, both the community placement and the case management process function independently until they converge. When it comes to the community placement section, it would be converge at selection, and for case management is at assessment. For the community placement side of the process, selection phase decides if the UAM, the minor, can be entrusted into the care of potential foster parents. So we select the foster parents which we feel that meets all the criteria of a suitable foster parent for the minors in our program. Even though we financially incentivize the foster families, we still look at minimal expectations in terms of standard of care, but also the physical elements, such as the families have a spare room for the unaccompanied and separated minors, the housing situation is suitable, sanitary, there is facilities adequate for a decent standard of living. We also look into the foster families in terms of the background, to see what the community says about them, whether they are of good standing within the community, if they are to be recommended by a community leader. And all this is because we do not have access to a formal process of a vetting through process, mainly because these are refugees and so on, and the state is not involved in that process or not interested to be involved in the process as well. So therefore, all this vetting through process is for us to ensure that we are reducing as much as possible the occurrence of abuse and neglect when we place our minors into these families. We have a form of training. We have training in the form of workshops to discuss childcare techniques, expectation of the program in terms of care for unaccompanied and separated minors, working with foster families from different ethnic backgrounds, different customs, different religions, and so on. We need to be sure and careful to make sure that we are all having a similar standard. Some cultures may have standards where maybe it's not too acceptable when it comes to how we are looking at it in terms of best practice of a child. So therefore, just having that briefing, that session, the training session is important so that we're all working on the same platform and expectations. Next slide, please. After the assessment is done, and normally we do it via a case conference, and that's made to determine support for the minor. The minor is then matched with the suitable foster parent. The case manager, because our program naturally, it is very case manager centric. Therefore, it subsequently develops a case plan with both the minor and as well as the foster parents to outline specific outcomes required to meet the needs and the goals identified by the minors themselves. As our program focus on case management, as mentioned, with community placement as a subset to address alternate care needs, therefore the case managers play a significant role in working with the unaccompanied minor in developing and implementing the care plan. The foster parents are important. They are definitely in the loop when it comes to care plan discussions, when it comes to implementation, but they play a very supportive role to ensure that that whatever goals and needs we have for the minors are sufficiently fulfilled. Next slide, please. So as we work through the process, maybe I'll just talk about how a minor were to end their time in our program, and there are various circumstances as to when a termination may occur. A termination can occur when a case is closed, all the goals have been met, new goals are not required for the minor. And this reason for termination is normally tied with the next few termination reasons as well. So number one being a durable solution is achieved, i.e., for example, the minor has reached the point where the minor is able to voluntarily return home back to the home country because it is safe to do so, it is to the child's best interests, or the child is to be resettled to a third country. A lot of the minors in our program are resettled to countries such as US and Australia. Many of them are resettled, to family members who have been maybe resettled earlier as a form of family reunification. Another reason why the minor would to leave our program and therefore terminated from the program would be the minor has aged out, meaning turning 18. But of course, our program has provisions for aftercare. We call it a transitional program where we phase out in terms of our support with the minor based on the child's readiness to be able to live independently. And of course, we do have occasions where the minor is no longer wanting to receive our service. Our program, being a civil society run program, is purely voluntary. We're not required, but the minors are not required by the state to be in such a program. And so therefore, the minor has to agree to participate in the program. And in the same way, and therefore the minor were to have the opportunity to decide whether they want to stay, they want to go in the program as well. There are occasions where the agency decides to terminate the case, and most of the time it's because the minor may be referred to another service provider who's providing a specialized care, or the minor has other kind of needs where the program itself cannot satisfy. The next slide, please. Maybe just a quick snapshot in terms of the life cycle of a minor in our program. Typically, a minor in our program would be with us for 2 to 3 years, because most of the unaccompanied and separated minors enter the country, Malaysia, around 15 to 16 years old, and they will come into contact with us as through the referral process, and therefore stay with us until they age out, unless as mentioned, they return home because it's to their best interest, or they are resettled to a third country. So the process is fairly similar to how any other case management would be done various parts of the country, the world. There will be a referral, screening, intake, assessment, care planning, implementation, monitoring, and as well as termination. Once the minor leaves the program, the foster parents then can decide if they want to continue to serve as the foster parent, but to the next minor entering our program. Maybe I thought at this point, at this moment, I would just share a little bit about a minor who has been to our program. This minor, not the real name, Reza. was one of the earliest minor in our program. He came from Afghanistan to escape persecution and war. When the minor at 16 years old came to Malaysia, he could not speak any English or any local languages. He was certainly at risk of abuse, neglect, and exploitation. He was definitely at risk of immigration arrest and immigration detention as well. On top of that, he was unwell. He contracted dengue and so on. After he was referred to us, our case manager went through the process in terms of looking at his safety needs and therefore placing him under the care of a foster family. To meet his welfare needs, we connected him to an NGO school so that he was able to attend classes. We attended to his medical needs. We also made a referral to United Nations High Commission for Refugees so that we're able to work through his legal status and find a resolution to his situation. He was quite fortunate. Within 2 years before he turned 18, he was recycled to United States. Because he was recycled there as a minor, he received a lot of support from the state, which was great. He was placed under a care of a foster family. He attended community college. He plays, football for the community team, volunteers with the community, and has really integrated well with life in the United States. And so therefore that's a minor whom we look back and feel that, even though we were not there throughout the boy's life, but that crucial years of, that years where he was an unaccompanied minor, was an important period where we intervened and made a difference upon. Just maybe the final slide before I end. We spent a lot of time looking at, not just in terms of developing our program, but we also want to document it and just write down in terms of how we go about doing it so that we are able to do things consistently. So we've produced quite a few materials. So we've produced a manual on case management and community placement. We've also produced some foster care handbooks and so on. The foster care handbook is skewed towards the Rohingya population, but the principles are fairly similar to what is practiced elsewhere as well. It's at our website. It's free to download, free to use. Feel free to look at it and comment, give feedback, use it, and so on. So thank you very much. I will stop here at this moment so that we can have maybe questions.
Thank you so much, Anderson. Very insightful sharing on the wonderful work that Suka Society is doing. We do have a few questions for you. I think I will start with you and then circle back to Louise, if that's okay. I think there's a question from Joseph asking how you manage to get resources, because you spoke about providing quite a bit of support to the foster carers who are taking care of the minors. So I think there's interest in knowing how you get the resources to support foster parents for medical minors, etc. Is this solely funded by is this funded by the government? What kind of support? Where do you get your money?
The thing about in Malaysia, Malaysia is not a signatory to the Refugee Convention, so therefore there is no support basically for work within the refugee asylum seeking community. We are a charity, so therefore we work on a charity model in terms of just fundraising and as well as applying for grants and so on. The thing about programs like this, it is very important to note that it cannot be simply run as from grants alone, because a lot of grants, at least in the Southeast Asia or our country, are very short-term grants, of a year, and a lot of it do not support, services kind of work. But running a program like this is multi-year. A child comes to us at 15 or 14. We cannot, after a grant period, tell the kid, or the foster family, that's it. That's all we can do for you. So therefore, a lot of internal resources needs to be developed. So a lot of fundraising, a lot of capacity. I mean, also working with partners. There are a lot of other NGO partners and so on who are providing good services. So the thing about case management is that it's really a networking exercise, really networking with a lot of partners, getting all the partners to look at the beneficiary, which is the child, and see how we can support the child collectively. With the foster family being a key backbone component providing the care. I hope I answered the question.
Yeah. I think you did. Maybe one question from myself. What's that one thing you would say is very, very important when working with foster, in terms of foster care or placing children in care options, that we should all think about or keep in mind to ensure that children in foster care or in other care arrangement are kept safe?
I mean, I think in our context, it's definitely a very important question, because this is outside the state-run program. So this is not a state-run program; it's a civil society-run program. The state is not. Unfortunately, the state is not interested in the population. So therefore, it is really left to the NGOs to work together to provide that support. And so therefore, we are not able to, do the usual, right? Get the vetting, from the police or whatever it needs to be for the foster family. So it's a lot of really time invested in understanding, knowing the community, getting to know the community, so that we are able to identify the right foster family. But because a lot of these foster families struggle, so therefore having a good case management program is crucial, because then you're journeying with the minor, and not just leaving the minor to be supported by a well-meaning foster parent, but under-resourced, or maybe even having cultural practices which is very different from what is the norm, in terms of practice by NGOs, very right-based kind of organization. So it's really that kind of connection, rapport building that needs to be put in. So therefore, it is very human intensive. It is very, and it requires quite a bit of work, in terms of what a case manager can handle, how many minors can therefore be handled by a case manager, and so on.
Wonderful. Thank you so much. I encourage everyone, we still have a bit more time, not so much, but if, there are more questions for Anderson or for Louise, please place them in the chat and we'll try and get to them. Louise, if I could briefly turn to you, could you share with us a bit about how the assessments of the children themselves fits into the assessment of prospective foster families?
Thanks, Barbara. I was really interested by that comment there, because I think, of course, assessing the capacity of carers to look after the children is such a good comment there. I guess there's a lot of places and a lot of people I work with at the moment where there's children that are already identified when they're in foster care. In my own context here in the UK, we probably would know who the children are in a kinship arrangement, and therefore there would be an assessment of the child or young person that helps support the assessment of the carer as to whether they have the capacity to care for that particular child. A lot of the assessments that I've undertaken are before we have identified a child for the carers to look after. And so the assessment is more general, and it doesn't look at a specific child. Once the carer is approved here, then we hear about children, and we go through a matching process to match the child with the carer, whether that's based on background, religion, ethnicity, things like that, and also their capacity to care for a child at a particular age, for example. So at that point, we would then look at the assessment, the specific assessment of the child, and do the matching. There is also another assessment time in the UK when we're looking at permanency in foster care. So a lot of foster carers care for lots of different children in emergency or shorter term. For shorter term, maybe 3 months, maybe 1 year, but maybe care for lots of different children in that time. Other children will be with the foster carer on a long-term basis. And if that is the case and the child cannot return to their family for some reason, then there would be another assessment to look at that child living permanently with the family. And we would definitely look at a child specific assessment for that. And often the carer will go back to the fostering panel to consider that as a long-term option for the child.
Thank you so much, Louise. I will still stick to you for a bit, if you'd allow me. Could you speak to us about training? Would foster families get training before they become caregivers? Could you address yourself to the question on training, please?
So again, in the UK, what happens is that there is a specific preparation training for foster carers. And at this point, generally, they're still perhaps deciding if they want to become foster carers and go through that process. So the training looks at lots of different areas of our foster care and what to expect, as well as what to expect in the assessment process. So it forms part of people's decision-making process as to whether they become foster carers. At that point, after that initial training, then there's this assessment process. And as I said, it's quite long here. So they might have access to other training throughout their assessment period. But certainly after they become approved, then there is further training, the more specific training, which then helps them, as they care for particular children, relate that training to the child that they're looking after. If it's possible, if there's something in particular, like a child has a specific medical need or something like that, there might be specific training in relation to that child that we identify for the carer. So it's a bit of an ongoing before and after process here.
Thank you, Louise. Anderson, I'm going to circle right back to you now. We have a really, really good question from Chipo Mukoki. Our theme is safety and protection in foster care. So, could you share with us your thoughts about how standards of care concerns, complaints and allegations against foster caregivers are managed and investigated in your setting, in the work that you're doing?
Yeah, I mean, we would be no different in terms of how a regular complaints mechanism were to operate. So what we do is that we do have a complaints mechanism, where we will inform the minors at the start in terms of how they can work through the complaints. We have not the case manager, but a child protection officer within the organization where the minor can complain about, because the complaint can not just be about the foster parents, it can also be about the case manager themselves. So therefore, them having direct access to the child protection officer who is not within the child protection, the community placement and case management team is crucial. And therefore, we will investigate accordingly. We do tell right at the start, in terms of to whether it's the foster family or to the minors themselves, and also to our case managers, that we won't discriminate in terms of how we take seriously allegations of abuse and so on, and therefore, running through the process of that complaint without any, fear or favor to anyone in particular. Yeah.
Yeah. Thank you so much for that, Anderson. Louise, do you have anything else to add from your own experience and context in the UK with respect to managing complaints and concerns?
In the UK, complaints are dealt with in a particular way, and allegations are managed in another way. My main experience has been with allegations against foster carers. And what would happen is there would be a particular person, a designated person within a local government department that would manage that. It would go to the police first, potentially, to whether it meets a threshold for their investigation. And if not, then it would come back to somebody, a social worker, to make an investigation into an allegation. And then that would come back through the panel process as to whether the foster carer remains an approved carer or not.
Thank you. I think we have one more question or two. Back to Anderson. Thank you everyone for sharing these questions. Anderson, would one case manager work with the foster parents as well as the minors, and or there being separate roles and responsibilities? So I think here we're trying to understand if you have one case manager that both works with the foster parents and the minors, or minors have different case managers and so do the foster parents. So explaining a bit more about responsibilities and roles.
Yeah, we do have one case manager who works specifically with the minor, and that same case manager would work with the foster family as well, so that, it's a little more consistent. I would like to have a bit more resources to have a dedicated foster parent case manager, but not necessary to case manage, of course, the foster families, just to provide support for the foster families, because as I said, a lot of the foster families are under-resourced and require quite a bit of support and so on. But it's the same case manager who will look into the needs of the minor, and then working with the foster families to support the minor in the program.
Okay, then thank you so much. I have one last question for the both of you. We've talked about investigations and complaints mechanisms and handling that process that you've all addressed, but how do we ensure the safety of the child during these investigation processes as we wrap up? Oh, Andy can go first. Oh, sorry, Lou. Sorry. Louise can go first. My apologies.
Fine. During the investigation, it depends on what the allegation has been here as to whether the child lives somewhere else during the investigation, and the child's view and what has been said. So that's a possibility. Monitoring visits, regular monitoring visits as well, I've also seen happen. But again, it depends on what the allegation has been, the level of risk and concern to the child. And if there is an immediate risk to the child, they will live somewhere else whilst there is an investigation.
Thank you, Louise. Anderson?
Fortunately, we've not, in the 7 years, we've not had a complaint against our foster families before. Of course, we are not a state-run program, so we don't, we don't have that type of scale in terms of numbers. But very similar. We will work with our partners, because we don't do case management in isolation. So if there is a need for the child to be removed for whether it's an investigation or whatever it may be about the foster family, therefore it's just placing the child at a separate location while we try and clarify what's going on and so on. But because our case managers are very active in terms of relationships with the families and as well as the minors, so generally the expectation is that our case managers are at the pulse of what's going on. so that we're able to see issues hopefully before they turn into something a bit more unsafe or for the minors.
Thank you so much. I think we got to most of the questions apart from one or two. Thank you so much to our panel members for taking the time to share your own experiences, to answer some of our questions. Just to highlight and stress again, the purpose of these is to really share experiences and our own thoughts. We've heard from the Malaysian context, we've heard from the context largely of the UK from Louise and Andy, but we'd love to also hear some of the learning and experience from other contexts in Africa and elsewhere around safety and protection, around assessment processes. So these conversations are, just beginning. We would like to then take these from this webinar to the task force meeting, which we encourage you to attend. This has all been very informative. We encourage you to join the task force group meeting, which is happening next Tuesday. If you join the Global Policy and Advocacy Working Group and the thematic task force on foster care, you will find details on how to join that meeting and how to contribute your thoughts. If you'd like any further details around foster care and what we've gathered so far, what information we've so far put together for the thematic brief, it's also available on there. So we welcome you to join that group. The group is being convened under the Global Policy and Advocacy Working Group. Yeah, thank you so much everyone for joining. We will be sharing the recording. It will be available both in English and in Spanish. Thank you so much.